set, we will go ahead and start. Good afternoon, everyone. Thank you all for joining today's webinar, Cultural Competency Unlocked with a focus on LGBTQIA plus population. Today's presentation is hosted by Vital Alabama and the Alabama Department of Mental Health. Please visit vitalalabama.com for more resources, both for professionals and individuals in the community. Also, you can find more information about the free Connect Alabama app. Virtual attendees will be muted and your video will remain off. You will use the Q&A box to ask the presenter questions during the presentation. The questions in the Q&A box will be asked at the end of the presentation. If you experience any technical issues during the session, please put a message in the chat box or contact aw@ua.edu. We're excited to have Lakin Newcomb and Auburn Catherine with us today. Lakin received her bachelor's degree in social work from Auburn University. After graduating, she worked in various outpatient medical settings. After moving to Huntsville in 2017, Lakin began a master's program at the University of Alabama. She earned a master's degree in social work and became an LMSW. Lakin has been working with the LGBTQIA plus population for over 4 years, with a focus on the HIV and AIDS positive community and transgender community, helping clients navigate the healthcare system to achieve their goals. Along with welcoming Lakin, please join us in welcoming her co-presenter, Auburn Cawthorne. Auburn Cawthorne is a transgender person in long-term recovery from an opioid use disorder. He started his medical transition in 2017. In his work in the community, he combines his lived experiences as a trans person with his recovery to provide support to his community. Without further delay, once again, we welcome Lakin Newcomb and Auburn Cawthorne as they share their insights on the importance of cultural competency within the LGBTQIA plus population. Lakin, feel free to take it away.
Okay, thank you. As she said, my name is Lakin. I am a social worker. I work at Thrive Alabama, which is a primary health care facility nonprofit in Huntsville. And today we're going to be talking to you about cultural competency as it relates to the LGBTQIA plus communities. I'm going to skip through a couple of slides here. We switched up the order a bit. So the first thing, I kind of want to start at the basics. So we never want to assume that people know something and then gloss over that information, and not everyone get to receive that information if that's what they need. So we're going to be mentioning this acronym a lot, so we're just going to go through these terms and make sure everyone knows what this acronym includes. So lesbian, gay, bisexual, transgender, queer, sometimes people refer to the Q as questioning, intersex, and asexual. There's also that plus at the end. That plus really leaves room for any terms or labels that people have yet to come up with, or that maybe just aren't included in this list. So something that we've been seeing a lot, especially with LGBTQ youth, is really this kind of rapid evolution of terminology around how they see themselves, how they identify themselves. And so, there are new terms and ways people are describing themselves that come up every day. And this plus really leaves space for anything that new that may come up or anything not included in this list. So let me go back one. Yeah. So I'm going to point out a few of these different terms and kind of go into them a little bit more, simply because some of them are common knowledge and some of them may not be. One thing I want to address is when we're talking about sex. So sex is not simple. People define sex differently. People's definition of sex will change based on what profession they're in, in the context of the situation. So some people define sex based on genetics, XY or XX chromosomes. Some people think that sex should be based off of hormone levels only, so certain levels of testosterone or levels of estrogen, and then also the presence of sex organs or reproductive organs. Some people think it is a combination of all of those things. Really, the message that I'm wanting you to get from this is that it's just not, it's not a simple answer. And depending on who you speak with and where you get your information, this is going to be defined differently by different people. So a term that you'll see a lot is sex assigned at birth. So this is, you know, your quote unquote biological sex, usually determined by a medical professional at the time of birth. So that is going to be, the factors that go into that decision are really only going to be the external sex characteristics or external sex organs. And that is how people are assigned a sex at birth. And people refer to this as assigned female at birth and assigned male at birth. And those acronyms, you'll also see those as AFAB and AMAB. So if you ever see those acronyms, you know what they mean. Intersex is one of the words that is in the LGBTQIA+ acronym, and it's a general term that is used to describe several conditions in which someone can be born with the reproductive or sexual anatomy that does not fit with our typical definitions of male or female. So sometimes that means people have a combination. Sometimes it means that maybe someone's genetics says that they are one sex, but they have the presence of certain reproductive organs that differ to that. There are several reasons this happens. Sometimes it is because of genetic abnormalities. It can also be due to syndromes like androgen insensitivity syndrome, or even things like PCOS. Some people consider PCOS an intersex condition. And this happens about 1 in every 1,500 to 2,000 births. That's about 22,800 people per year who are born with ambiguous gender or presenting with a situation that does not fully fit into what we would consider a typical definition of female or male. So when we're thinking about what you're assigned at birth, not everyone identifies with that. And this is where gender identity comes into play. So gender identity is one's innermost concept of self as male, female, a blend of both or neither. It's how someone perceives themselves and how they identify themselves. And one's gender can be the same or different from what they are assigned at birth. Another important thing to note is that sexual orientation and gender identity are two separate things. They are independent from one another, and they can change and evolve over time. So just because one changes doesn't mean the other one does, vice versa. So these are also not cross-cultural, meaning that while the concept of gender identity and sexual orientation exists across all cultures, different cultures understand them differently, they categorize them differently, and they are recognized differently. So this does not mean that, it basically means based on the setting or the culture that someone is in, it does not mean these certain terms still apply. So this is not a cross-cultural identity, basically. So given all this information, what does that mean for people working with the LGBTQIA+ community? So it's important that we acknowledge that there is a history of medical mistreatment when it comes to the LGBTQIA+ community. So, you know, and this is not only true for this community, it's also true for communities of color. If you look back in history, you'll see things like the Tuskegee syphilis study, where there was clear mistreatment of, marginalized communities in the medical field. And this is also present with LGBTQ folks. So the Center for American Progress did some research in 2020, and it said that among LGBTQ respondents who visited a doctor or healthcare provider in the last year, 8% said that a doctor or other healthcare provider refused to see them because of their actual or perceived sexual orientation or gender identity. 6% said that a doctor or other healthcare provider refused to give them health care related to their actual or perceived orientation. 7% said that a doctor or healthcare provider refused to recognize their family, including a child or a same-sex partner. 9% said that a doctor or other healthcare provider used harsh or abusive language when treating them. And this last one is really impactful, and I definitely want us to kind of let that sink in. 7% said that they experienced unwanted physical contact from a doctor or other healthcare provider, and that includes sexual assault or rape. So these are not small things. These are life-altering experiences that people have had, and when these things happen, it makes people distrustful of the environment that these happened in, rightfully so. So it's important that we recognize that this has happened, and this means that we then have a little bit of, in the medical community, have a little bit of a barrier to overcome, because if someone from this community goes to the doctor, they already have, if it hasn't happened to them, someone has told them, hey, this happened to me, this happened to a friend, this happened to somebody I know. So they are coming in with that distrust. And it is up to us as the professional to overcome that barrier and establish that rapport and make sure that we're doing everything we can to make them feel comfortable. So there are a lot of mental health considerations to take into account when it comes to this community. So people who identify as LGBTQIA+ experience higher rates of mental illness. It's incredibly important that we make it clear being gender diverse or LGBTQIA+ is not a mental illness and is not the cause of mental illnesses in this group of people. So these mental illnesses are experienced at higher rates due to the perception and the environment and how essentially society reacts to someone who is LGBTQIA+. So again, this is not happening because they are LGBTQIA+. This is the result of reactions to those around someone who is LGBTQIA+. This next data is coming from the Trevor Project's 2022 National Survey, and this is specifically for youth. 45% of LGBTQ youth seriously considered attempting suicide in the past year, including more than half of transgender youth and 1 in 3 cisgender youth. 14% of LGBTQ youth attempted suicide in the past year, compared to 10% of the general youth population. 60% of LGBTQ youth who wanted mental health care in the last year were not able to get it. So this is just establishing that this is data supporting that these mental health issues are absolutely present and that people are trying to seek help for these issues, however, are not able to accomplish that for a variety of different reasons. One of those being just lack of cultural competency around these issues and a lack of providers who feel comfortable treating that. But it also speaks to a lack of education in our school programs. So In medical schools, nursing schools, I'm a social worker. I feel like there is a lack of it in my undergrad and master's program. So that is something that we're going to have to keep working on and make sure that through all verticals, this is training that happens. The American Psychological Association also released some really great data. I am going to move this little screen out of the way so I can actually read this. Okay, so LGBTQ individuals are more than twice as likely as heterosexual men and women to have a mental health disorder in their lifetime. LGBTQ older adults face a number of unique challenges, including the combination of anti-LGBTQ stigma and ageism. Approximately 31% of LGBTQ older adults report depressive symptoms. 39% report serious thoughts of taking their own lives. That is also an important note. So when we look at suicidal ideation and suicide attempts, the age group that this happens in the most is older adults. I believe 65 plus, it might be 75 plus. So that's another consideration to think about when taking in information like this. Transgender individuals have higher rates of poverty and unemployment than non-transgender individuals. And this is exacerbated by a lack of federal employment non-discrimination protections for LGBTQ individuals. All right, so why are these, what's the reason for the existence of these higher mental health issues in these communities? So the big one is going to be attitudes. So the stigma and discrimination associated with someone identifying as LGBTQ+. A majority of LGBTQ+ people say that they or an LGBTQ+ friend or family member have been threatened or non-sexually harassed, been sexually harassed, or experienced violence because of their sexuality or gender identity. So, and this is outside of a medical environment. So this is just, going about your day, interacting with the world. 22% of transgender individuals say they have avoided doctors or healthcare out of concern that they would be discriminated against. There's also something I see, especially in my work, is a lack of support from family specifically, but also just weak support systems. Unsupportive parents especially. So it is not uncommon for a child to come out to their parents and subsequently be kicked out of their home or cut off financially, different things like that. And being disconnected from that support system is a huge social determinant of health. And it also leads to an increased risk of being unhoused. 28% of LGBTQ youth reported experiencing homelessness or housing instability at some point in their lives. So, and this is youth. So we are talking about people under the age of 18 who are experiencing homelessness. There's also a lack of inclusive supportive services. So when we find someone who has become unhoused for any number of reasons, and we are looking for a temporary or permanent solution to that, there is a lack of inclusive services like homeless shelters. You will almost always, someone has to say, I'm male or I'm female, and that is who you're put with in the shelters. Domestic violence shelters are the same way. This can also be an issue when it comes to situations like rehab. There will also be a denial of medical care, either because insurance will not allow it or a refusal by medical staff. And that was cited in some of the earlier data. So we've established that there's a problem. What can we do better? So these are two things that, in my opinion, are the bare minimum when it comes to respectfully interacting with this community. So many people will have a chosen name, and that is a way to identify yourself that is completely your own. It can reflect who you are. And when someone has a chosen name and they're referring to either their former or their legal name, they sometimes call that a dead name. So that is a term that you will hear around. Some people may say, oh, so and so dead named me. And that means that someone used, a name that they previously went by. So it's important for us to respect someone's chosen name because it's how they want to be referred to. It's also important that we recognize that that dead name is more than just a name to them in a lot of situations. So there can be a lot of trauma and emotion wrapped up in a dead name. And using someone's dead name can bring a lot of that emotion and trauma back to the surface. Mistakes are going to happen. And that's true with pronouns as well. So pronouns are, basically how we refer to someone when they aren't there or, in the third person. So he, she, and they are the main pronouns. There are several others in other languages. There are also some that are completely gender neutral pronouns. I would encourage you to look those up as well. A lot of people get really hung up with the they pronoun. So I want to make it clear that, we've been taught that they is a plural pronoun, and that in a lot of cases can be true, but using they in the singular is still grammatically correct. So if someone asks and says, hey, I use they, them pronouns, we respect that, and it is still grammatically correct for you to refer to a single individual as they. Like I said earlier, mistakes are going to happen. So, you slip up, you forget someone's chosen name or their pronouns. Everyone's human. This is going to happen. The best thing to do is just say, I'm so sorry. What I meant to say is blank. If you don't have that information, maybe you're speaking with someone for the first time, and you did not ask beforehand, and someone says, oh, my pronouns are blank, or I go by blank. You can just say, thank you so much. I promise to honor that in the future. And this goes such a long way in building rapport and establishing trust with someone. And this is something that is not just important in, a professional client relationship. This is something that people really need to be doing in everyday life, regardless of how you're interacting with someone or where you meet them. So, as kind of a call to action, I want to encourage everyone listening today to use this as an opportunity to educate yourself. So, just being here, present, and listening in this webinar is huge. When you come across maybe terminology you aren't familiar with, if you have more questions about pronoun use or need to practice using different pronouns, definitely do some Googling. I also have a bunch of resources on the next slide. And, research how your field interacts with the LGBTQIA plus community, and not even just your field, your work specifically. How can, in your current position, can you ask for further training in your either classes or workplaces? Can you advocate for more inclusive training when it comes to these issues? And then also ask yourself, in your current role right now, what change can you initiate? It's not as if we can wake up tomorrow morning and change the entire world or change our entire organization or how we operate, but we can, initiate small change where we are now. So, maybe that changes just with you. You start asking, hey, is this the name you prefer to go by? Or, how would you like me to refer to you when we're talking? Different things like that. That can just go such a long way to making someone feel comfortable, feel seen, and have the presence of, that little bit of support that is so needed. So here is that further resources. You guys will have this recorded, I believe, but I will also submit these slides for you guys. So you will have these links. The first one's just an article, so cultural competence in the care of LGBTQ plus patients. This last one on here is really fantastic. So this is a completely free online database essentially to all kinds of LGBTQIA knowledge. I believe it is hosted by the Finway Institute. You do have to create like a login and password, but it is completely free. And there is just such a wealth of incredible information on that site. So I really encourage you to do that. So that is it for me. I can do is go back and introduce my dear friend, Aubin, who will also be speaking with you guys.
Thank you, Lakin. Thank you all for being here today. My name is Aubin Cawthon. I am a person with trans experiences, also a person in long-term recovery, and that is a huge part of my story, which is why even though we're not talking about substance use specifically, I always include that. I want to start off by saying thanks to Lakin. We've presented on this topic a couple of times together now, and I love to get to hear kind of the clinician's aspect or the social work aspect of that. I am here to talk about the lived experience, and so kind of to give some backstory. When I was a adolescent, 11 or 12 years old, I recognized that as a young female, I was not attracted to males. When all of my friends were going around getting their little middle school boyfriends, I was not. And there wasn't a lot of representation of that at that time. This has been quite a number of years ago now, and so there wasn't anybody for me to see to mirror what I was feeling on what that could look like in life. So I had a lack of representation, and as a result of that, did a lot of isolating myself in social situations, isolating myself in a time in my life where that development was pretty important with that social interaction. And within a couple of years, I recognized that I, at that point in time, identified as a lesbian, as gay, and there were still not a lot of representation. I had a little bit in my social network, but I was also raised in a very religious household, where I was very clearly told that people like that were going to a certain place and did not really have a place here. And so I grew up knowing that what I was feeling was wrong. Knowing, we'll put that in quotations, that what I was feeling was wrong, and without that representation from any adults in my life, didn't really know where that fit in for me. So when I was about 14, I told my mom that I liked females, and her exact words were, "You are going to a certain place, and there's no room for that here." And so very quickly told that I will not be supported in the way that I feel, and that kind of snowballed a lot of problems that were going to come in the very near future for me. So I continued to understand, again in quotations, continued to understand that I did not have community support, that I did not have a community to show me how that representation looked in my life, and so continued to stay very isolated. By the time I was about 16 or 17, I guess about 16 or so, I had found that substances numbed those feelings very well, and I didn't care what other people thought about me because I was under the influence. And that was how I found that I could, at that time, what I felt authentically be me. So again, still didn't have a lot of friends who identified outside of straight, cis identification. And so I had a couple of friends who who were questioning, who were exploring, but not much. And at that point in time, I also recognized that maybe I didn't fit into this very clear gay or straight box. And so there was more going on there. And we're still talking 20-ish years ago. And so there wasn't a lot of language, there wasn't a lot of terminology, and there wasn't a lot of information or education on what I was going through. To fast forward a little bit, I finally kind of hit this place where I recognized that I didn't necessarily feel like I identified with the bisexual community, but that's the closest that I identified with on my sexuality, and had not even, I didn't even know having a conversation about my gender identity was an option at that point in time. The things that I encountered at that point, as teenagers, we were trying to make healthier decisions. And so I remember I would go down to the local health department to get tested. And they would ask me, about sexual partners, and I would very explicitly tell them that I had sexual partners with other females. And then they would battle in on the questions about pregnancy chances and birth control and things that straight hetero teenage women would be looking into in my situation. And they would never understand or never hear me when I told them those weren't the types of interactions I was having, as if I didn't have a category for their conversation. So very early on, I was taught by my community that there wasn't a conversation for me. I was outside the box of their purview. When I was about 19 or so, I had an amazing opportunity to leave Alabama, which changed my life forever. I traveled, I met some amazing individuals who identified in so many different ways and who recognized themselves as individuals, and learned a ton. The first thing I can say, Lakin mentioned, pronouns and names and how we're going to mess those things up occasionally. And it's understood. And even as a trans and queer person, when I met my first trans non-binary queer person, and I messed up their pronouns immediately, and I felt so ashamed and so pushed out of that community because I was from small town Alabama and had no clue what we were talking about. But I knew that those were my people, and I knew I identified with them. I just didn't have the language. And so it's understood. We all recognize that growth and change and education and learning has to happen. And until we're willing to walk through those uncomfortable mistakes, those changes don't happen. So that's kind of my stance on it. But when I had that opportunity to meet amazing individuals, it gave me a chance to explore what that actually looked like for me with representation and with terminology, which was a total game changer. So I had a friend offer me a chest binder, and was like, I don't know if you've ever tried one of these, but I feel like you might like it. So here, I want to give you mine. And the second I put that binder on was the first time at 19, 20 years old, the first time I held my head up and shoulders back in my entire life. I felt like suddenly I was a person, and suddenly I could be seen, and suddenly I had something to stand up, a reason to stand tall. And that was a feeling I had never felt before. And so something as simple as a garment changed everything in that interaction, changed everything about the way I could view myself. And that was the beginning to a process that I am now in. So I continued on for the next many years. At this point in time, I was still struggling with substance use and no insurance, no access to care at that time. And I still didn't recognize that anything more than going by a different name was an option for me. So I started using the name that is now my legal name, Aubin, and kind of pushed this other person to the background. I had found a new me, and this new me felt amazing. I traveled a lot, spent a lot of time outside of the South, where I would walk into a healthcare facility and questions on documents were legal name, preferred name, sex assigned at birth, gender identity, lots of inclusive language in documents before I even talked to the receptionist. which allowed me to feel seen and like there was a space for a conversation for me. I can say out of personal experience, when I walk, and even still today, many years later, when I walk into a medical facility or a clinical facility and I see those types of questions, I know this is a space where they see me. I know this is a space where I can feel safe, where I can feel comfortable, where I can have an open and inclusive conversation about the different aspects of my life and what I'm going through. And I don't walk in with fear and reserved, which ultimately would keep me from receiving the treatment needed, right? I do want to say that I recognize, I was like having a conversation with Lakin before this, and I was like, I don't feel like I'm qualified for this conversation, because I recognize that although I've had negative experiences in the healthcare field, I've had negative experiences in the community, because every queer, trans, non-binary person I've ever met has. But there are so many people who have had way worse and way more traumatic experiences than I have. And so I want to make that really clear that my story is my story. And there are many stories that go far deeper than mine does. And I think it's important to note that. So anyways, I came back to Alabama when I was about 23-ish years old. And immediately remembered why I left Alabama. There wasn't representation for me. There wasn't a community here for me. So much so that I started working at our local gay bar, and I had less understanding and representation through the gay community than I did through people I met on the street. And that felt like, well, now where do I go? Right. In a city where we didn't have what I would consider a queer community. We had this very mainstream gay community, and I didn't have representation there. I wasn't seen as me there. And so that really threw me for a loop after coming from the amazing inclusive community I had just come from. Shortly after coming back here, I had spent the majority of that time away identifying as non-binary, because that's what felt like it fit the most for me at that time. And when I came back here, I used neutral they them pronouns, and for me that felt very like I don't know that I necessarily fit here or there. I like this middle ground. This is where things feel comfortable for me. And when I came back to Alabama, that became really difficult really quickly. I did not only was there no trans queer representation, but there was like no representation outside of this mainstream gay community. And getting people to get on board with using correct pronouns was an everyday battle. And it became exhausting. And so for myself, and this is not for anyone else, this is my journey. I took a step back, and I always identified more masculine, non-binary. And I made a personal decision that I was going to venture into seeing what medical transition would look like for me. And I started speaking with a therapist about this idea, and started moving forward with it. And so for the next number of years, I still, when you look at me, you perceived me as very, very androgynous. Not anymore, obviously, but for a lot of years, I was very, very middle ground in that physical representation. And when it came to general population and general public on a daily basis, receiving hate speech and threats, and people from just all kinds of nasty language from people who I didn't know, people that just saw me walking down the street or walking through Walmart. And I had this conversation with someone the other day. People who are in marginalized communities of any type they're the people who understand what that feels like, and so it's hard to understand. Every time you go to Walmart, you at bare minimum get scowls from people at bare minimum, and that's on a really good day. Nobody said anything today. And when I would go into healthcare environments, I was consistently misgendered, consistently dead named, a term that Lakin brought up earlier, because the representation wasn't there on documentation. And if I told people, hey, this is how I identify and this is the name that I go by, it was almost seemed as a joke. It wasn't taken seriously in any way, shape, or form. Lakin mentioned inside rehabs and kind of placement on that. Prior to medication or prior to medical transitioning, I went into substance use programs as an adult, as someone who had identified as trans for a number of years, and had to be put on the female side because that's what my marker said, right? And that was not an environment of growth for me. That was not an environment of inclusion for me. And so, in a time of my life where I was seeking help, I was trying to navigate this opioid use disorder that had as a result of had lost everything in my life. And I didn't have a space that felt like a space where I belonged to be able to go and receive that help. As a result of that, I felt very isolated inside treatment facilities. Even with some amazing counselors and amazing staff who did their best to use the right names and use the right pronouns, when you put me in a circle with a bunch of females, that was not the representation that I felt was my representation, and so it became difficult to fit into that therapeutic environment. As a result of that, the way that I received help this time was not an inpatient facility because there were no options for me to go to an inpatient facility and have that inclusive environment. But around 2019, I had been on hormone replacement therapy for a while and had decided that I was going to start looking into surgery options. I had a good job that I got specifically because they had insurance that would cover things like surgery, Blue Cross Blue Shield insurance. I looked them up and saw that they were trans inclusive, that they would cover gender affirming care. And so I got this job specifically for that. And I worked this job, which was a high physically demanding job, for over a year before I was at a point where I was ready for surgery. Went through all the paperwork, went through all the doctor's appointments, ended up, I got my surgery date, which is like, it's like the most amazing feeling in the world to get the call that like, we have your surgery date. And they said, but we have one problem, your insurance was denied. And I didn't understand. And I asked a lot of questions. And what I found out was that my employer had a clause in their policies that was trans exclusive. And so their policy would not cover any gender affirming care surgeries or treatment. So I spent all of this time and all of this energy and all of this effort working for this company because they had the insurance that I needed, just to find out that it wasn't going to be useful anyways. So thankfully, I had an amazing community that pulled together. We did a GoFundMe. My wife was phenomenal and raised all the money that we were short for me to be able to continue on with this surgery. And I left the job. So that was the only reason I had the job. So I no longer wanted to work at a place that did not affirm my existence. So kind of to put us now where we are. So I'm a number of years in through my transition. I recognize that I have a privilege to, when you look at me from the outside, you see a family unit that looks very cis, heteronormal, me and my wife and my 2-year-old daughter. When I walk down the street, people just, they see another guy, they don't think anything about it. And so I want to talk a little bit about that internal aspect of that and the fear that goes along with that. And so yes, it is so much easier today that I get to walk around and nobody, I don't have a stamp on my forehead that says I'm transgender. But I still live with the understanding and knowledge that I am, and now I'm walking around in this world that doesn't see me. So there's this duel that happens in that, but also the fear and safety aspect of that as well. There obviously my existence is a big topic of conversation right now in the political world we live in. And so talking about the bathroom accessibility and medical accessibility and, will I be forced to use the same bathroom as Lakin? And just all of those differing concepts and ideas coming from people who don't have the lived experience. is something that we all live with. And again, I recognize the privilege that I don't deal with hate on a daily basis because I blend in, for lack of better words. But I also have a wife and a 2-year-old daughter. And as of yesterday, have legal documentation drawn up to make sure my family unit is protected no matter what happens. And it's a financial privilege that I get to do that, right? So I think just being able to share that lived experience of even as someone who represents in a way today that isn't so outwardly different from everybody else I'm passing by, I still recognize or I still have to deal with a lot of different things in my day-to-day life and a lot of different fears and concerns in my day-to-day life of not knowing if my existence is going to be questioned, of not knowing if my rights are going to be taken away. I do want to take just a minute. I know that I'm right at the end of my time, but I want to take just a minute to talk about healthcare providers and clinical providers that have done things right in my life. Like I said before, there's a lot of people with significantly more negative interactions with the clinical and healthcare world than what my experiences are. And I want to note that. Please explore that more. There are people with really, really, really traumatic stories that are personal friends of mine. That's not my story, but I do want to talk a little bit about the people who have made things better for me. And so I have an amazing doctor down in Birmingham that was the very first doctor that when I walked in, I was like, this is what this is supposed to feel like. Everything in the documentation was inclusive, and they made sure they were clear on anything and everything that would make me feel comfortable as a patient of their agency. My doctor cared about me and cared about making sure that my overall health and well-being was taken care of. We weren't just going to look at, oh, you want hormones, we're going to give you hormones, or, oh, you've got to jump through a million hoops just so you can get hormones. But he immediately started treating me like I would hope any doctor would immediately start treating any new patient. And that's to make sure that holistically my health and well-being are taken care of. Getting into a therapist, getting into therapy with somebody who sees me and understands me and has knowledge and information about the trans community and the different struggles that the trans community has been a game changer for me to be able to be transparent in that relationship. And even to speak on my wife for a moment, she is a cis woman who had struggles finding a therapist that recognized her family unit as a legitimate family unit. So that it's not just a struggle for me in my life, but it's also something that my wife has to be mindful of and aware of as well. Also, being able to access that healthcare. I'm now at a place where I'm about to move forward with a hysterectomy, which is kind of for now the last step in my process of medical transition. And I had a doctor that I was going to go to that my doctor was referring me to. And I dropped the ball on calling. About 6 months later, I went back to my doctor and I said, hey, can you give me that referral again? And he said, I can't refer you there anymore. And I said, why not? And he said, because that doctor has now decided to make sure that their patients don't want to keep certain parts just in case. And he was like, so we're not sending people there. And so the reality of the situation is that any doctor at any given time can decide that, oh, well, my agenda looks this way, even though this is the medical care you're requesting. And so I'm going to push my agenda on that. And that puts me in a very harmful situation with that medical professional. A very uncomfortable situation. I assume everybody has medical anxiety. So compound that with also having trans anxiety, and it becomes a very uncomfortable situation. And so I finally have found another facility that is more inclusive. And again, as soon as I looked them up online, their documents were inclusive, and I knew off the bat that they were going to hear me and see me as the human being that I am, and not try to coerce me into pieces or parts of medical practice that I wasn't interested in. And so just to kind of bring it all in together, I think that as professionals, the easiest thing to do is to educate oneself on terminology. It does go a long way just to simply ask the question, how do you identify? What name do you prefer? Those two questions make a world of difference. Do you have a preferred pronoun? What name would you prefer to go by? That in and of itself, those two easy sentences make me feel like you see me as part of the conversation, as the whole human that I am, and that you're going to treat me as such. And that's a very simple thing that everybody can do. Outside of that, continued learning about the impacts of negative interactions on the trans community. This is a short time, so I didn't really get to go a lot into it, but I am part of that percentage of people who attempted suicide and who had suicidal ideations for a large majority of my young adult life. That compounded with substance use is extremely common in the trans and LGBTQIA plus community. And so it's something to be aware of. I do love the fact that I get to take my lived experience as a trans person and as a person in long-term recovery and be able to pull that into one to help other people in my community. Yeah, thank you again for your time. Thank you all for joining us today, and I hope that you got something out of this presentation.
Thank you. All right. So now we will open up for questions. Feel free to submit any questions in the chat, and we will get to as many as we possibly can. Someone asked, could you discuss how religion plays into the stigma, the LGBTQ population?
I can share my personal experience on that, being raised in an extremely religious environment. I was not given an option outside of how cis hetero population existed. I did not have an option outside of that. Anything outside of that was considered a sin and not welcome. I can say that there has been amazing growth in certain populations within the religious community. I work very closely with the Episcopal Church up in Huntsville, and an extremely affirming environment. One of the priests I work closely with has a transgender son. And so there are different pockets of the religious community that is affirming and holds space. We also have an LGBTQI plus church specifically in Huntsville that is a Christian church up there. And so I think it exists. That was not my experience. And overall, I think more specifically in the South, that's not the experience with religious interaction. But there are pockets of community inside the religious world that tries to be affirming and inclusive.
Thank you. So another question for you, Avon. When you got into recovery, did you face any hardships or exclusivity? What advice do you have for an upcoming CRSS to provide an inclusive experience to clients?
I struggled immensely when I first got into recovery. I'd been in and out of recovery for a lot of years, but when I came in this time, people had seen me pre-transition. They had seen me under a different name and pronouns. And so it was really, really, really hard, with as diverse as the recovery community is, to find people who were affirming to me. So I struggled deeply with that. As an upcoming CRSS, I would say treat every human being with dignity and kindness. Listen and respect one's requests, whether it be name, pronoun, creating space, inclusive space, or inclusive conversations for everybody, no matter how they identify or who they are.
Thank you. And another one, when specifically looking at residential treatments, are there any facilities equipped to allow trans individuals to be in the population they identify with?
So in Alabama, I know somebody earlier on in the comments mentioned Fellowship House. I don't know their exact setup, but I've had specifically, I sent a trans woman to Fellowship House, and she came back just giddy about how inclusive they were with their programs and interactions. I also know that River Valley, which is a state facility up here in Madison County, does their best to be inclusive. When it comes to bed spacing, a lot of times what you end up with is doing private beds or one bedrooms for individuals who may fit outside of that scope of quote unquote normal for that facility. And I hate to use the word normal, but I think a lot of other states may have some better representation of that. We also have one recovery house in Alabama that is LGBTQIA plus specific, and that's in Mobile. So we have some representation here, but I think creating policies and procedures that are inclusive policies and procedures is where that starts.
Yes, and in other states, not necessarily in the Southeast, but I've done a decent amount of research in Midwest, Northeast, and even, basically along the two coasts. There are so many more resources like that. They unfortunately do tend to be more expensive, not to mention the cost of, traveling there, getting there to begin with is going to be a higher cost if it's not, within your state. But if there is someone looking for that inclusive environment who has the ability to travel to get that done, there are some really great out-of-state options that really go above and beyond when it comes to that aspect of things.
Thank you. So I have another question for Auburn. If you're comfortable, would you mind discussing your experience with navigating the healthcare space for your initial GAS? I know there are very few plastic surgeons in the Southeast that perform GAS. Did you have to travel for the surgical care? Were you provided with housing? Sorry. So could you did you do a follow-up with your surgeon? Did that team work with your local healthcare team? They are a current research fellow in plastic surgery interested in possibly pursuing being a gas provider. Thank you for sharing your stories, what they said.
Thank you. First off, thank you for starting that question if you're comfortable with sharing. That's an important part to put up at the top. The only gender affirming surgery I've had is a double mastectomy that I did have done in Birmingham, Alabama. There's a couple of surgeons in Birmingham that provide that surgery, or at least did 4 years ago. I did not travel because we were working on GoFundMe funds. There wasn't a lot of options outside of what was local. There are significantly more higher ranked surgeons for that particular procedure outside of Alabama and kind of the Southeast in particular. But that wasn't an option for me due to financial restraints. But there are options here. Again, they're not the highest rank options, but they're good options. Lakin is actually an amazing person to provide resources on people who have been trusted as local providers.
Yeah, so there used to be several, well, I guess let's start with this. If we're talking about what people refer to as top surgery or a double mastectomy, chest reconstruction, anything like that, there used to be multiple in Birmingham who were really great. I believe there's only 2 now, if I'm not mistaken, and I'm unsure of the circumstances surrounding that. Here, though, Auburn and I are in Huntsville, and there is a local surgeon who does top surgery. A lot of the issues we've been running into lately have not been necessarily with finding a surgeon willing, but it's that surgeon's requirements for the patient. So, obviously you have to obtain multiple letters from medical professionals and mental health professionals in order for insurance to cover that or for the surgeon to even be willing to do it. Also, a lot of them we've seen have a BMI requirement. So, your BMI has to be below, I believe, 30, if I'm not mistaken, is like the most common thing that we hear. I do know of a couple who don't have that requirement. Um, for this person, Chandler, I believe is your name. If I will happily give you my email if there's other questions like that I can answer. This is something I've done an extensive amount of research on for my patients. So if any questions specifically for me, please definitely let me know because there are surgeons in the area who offer these things, but they certainly do not publicize it. And I've done a lot of kind of cold calling on my own and had some pretty interesting conversations with some people about it. But I would be happy to share my knowledge with you as well offline.
I will also add real quick, another barrier that comes into play. When I had my top surgery done, the hospital I was supposed to have it done at was a religious hospital who blocked being able to provide those procedures at that hospital. So last minute, everything had to get changed to a different hospital in order to be able to provide that procedure.
Thank you for sharing. Thank you for adding on to that, Lakin, as well. If we have any other questions, you guys can put them now in the chat. All right. We will go ahead and wrap up. So thank you again to Lakin Newcomb and Auburn Cawthorne for their time and expertise, and to all of you for joining today's important conversation. As we continue to strive for cultural competency in all aspects of our work, it is vital to keep those conversations going. I encourage you all to take today's learnings back to your organizations and communities. Once we confirm attendance, you will be emailed a link to complete the evaluation on Friday, December 20th. Please complete this evaluation by the close of business on Friday, January 3rd. Once you've completed the evaluation, please allow 2 weeks to receive your certificate or contact verification form. Counseling CE certificates may look different than what you're accustomed to seeing. We work directly with the Alabama Board of Counseling to issue ABEC certificates. You will not be receiving a certificate issued by the NBCC. Thank you again, and we hope to see you at our next Cultural Competency Unlocked webinar on January 15th with a focus on homeless population. If you haven't already, please visit vitalalabama.com to register and have a great day. Thank you, everyone.